Dear Fish Keeper, today I will talk about fish disease case number 12, about the Aulonocarra. It's a Malawi cichlid, and the Malawi cichlid which I will show here today, he looks stressed, he is skinny, he has some lesions, a cloudy eye, but no typical pathologic symptom what we can see with the naked eye. So I show you some photographs and some of my microscopic observations that can help you. When we saw the fish, it was obvious that a few patches on the skin could have been noticed on this Aulonocarra, and the eye seems to be somewhere damaged. Could have been a lesion of aggression or other cause we could not determine, but we know that the fish was acting not so healthy. You will see it, how the fish is swimming, how skinny it looks. You see some patches on the side, you see some of his fins are a little bit, how can I say, frayed. You see here a few patches here on the body. The fish particularly was very skinny. Well, I took the time for this fish to sacrifice because he had a lot of friends left in the tank. About 50 of his male and female friends were still alive. And what we found here is on the skin scraping. Here it's at the magnification of 50. We saw a kind of patchy area here, which was not clear for me. So we magnified it and we start seeing that it was a moving object. This was an organism. Very difficult to see at this magnification what it was, but it's not a white spot, it's not a small unicellular parasite like Haladonella or Costia. So we go to a higher magnification of 200. And then we could see here, it's like a worm type, flatworm. A flatworm which is sitting on the scales of the fish. Here we see it again, another type of coloration. You see the two pigment eyes of the worm. You see the body shape of the worm. It's a typical kind of a flatworm, a kind of monogenetic trematode. Don't know exactly what species it is, I'm sorry. I don't spend time and money to identify exactly what's the scientific name of this kind. But what I know is it's a flatworm living on the skin of a fish, which is a kind of monogenetic trematode, and that can cause damage. So what you want to do is to treat with the medications we have. But we didn't stop searching, finding this worm on the skin. We also looked at the gills, and we saw that the gills were pretty red. And look, badly reddish, stressed gills. A lot of slime, some bacterial intrusion here. So the healthy gills were not there. So the fish were also suffering from a problem in the gills. And this could have been caused by a problem by the inner organs. If we look inside in the intestine, we found bloody patches in the intestine. This is in hemorrhagic lesions. Could have been caused by bacteria, for example. It's like diarrhea in a fish can be causing this kind of symptom. So the fish might have had food which was in bad condition, or the fish was in polluted water with too many bacteria, but this is not normal to have these bloody streaks in the intestine. If we looked further, we saw a lot of greasy, fatty degeneration. Also the organs here, like the liver, had red patches, holes, and had a fatty degeneration. Could have been caused by a bacteria, so the organs were in poor shape. And what was very bad, when we checked the kidneys of the fish, in the kidneys we found all those kind of MMCs, melano macrophage centers, which is a reaction on bacterial infections in most cases. Most cases bacterial infections. So this is going to be due to a history of the fish where he had been exposed to a bacteria or exposed to food with bacteria, microbes into the food. So that could have been his suffering. And this was making the fish very weak. When these kidneys like this look like, they fail. And the gills will fail because the gills will have to take over the job of the kidneys. And then being stressed. So kidneys are bad, the gills are bad, fatty degeneration, and then on top of it, they had some skin flukes. So this is a complex problem. for this kind of fish. The first thing you should do, apply an antibacterial medication like furaltadone, 1.5 grams per 100 liter, or oxytetracycline, 3 grams per 100 liter. Check for sure your quality of food, frozen or fresh. And try to avoid feeding frozen or fresh food, fly food, during the next 30 days. Try to give granulate foods which are free of microbes. Meanwhile, try to kill the parasitic flatworm on the skin, because that's also hurting the fish and causing lesions. You can use praziquantel at 250 mg for 100 liter. And try to help your fish by feeding it with pro and phytobiotics to help their defense system and for repair. Here in this case, I would recommend the Dr. Bassleer Biofish Food Fuco. So this complex problem, which we found on the Aulonocarra, might give you some idea what you can do about it. And maybe you will encounter also this problem in the future. The next case, number 13, I will talk about a marine fish. This Abudivdiv Cyaneus, the blue damsel. An interesting case. See you next time. Bye bye.